So the three defense layers are present in the. I'll show you a picture here. Arvaz. Yes, I'll just speak. No, this one. You can see here. Yeah, you can see here. This is a micro pit that is the millions of pits are present in the rugae, the folds of the stomach. This is the micro pit. The whole thing is a small pit. You can see different cells here. This is the mucosal cells, and this is a parietal cell, this is endocrine cell, and these are the various cells that produce different chemicals. And I'll show you the next pic. Yeah. So this is exactly the three-layer defense that we have. The mucus layer and the epithelial layer and the microvasculature, this is blood supply. So this is a protective layer, the superficial mucus protective layer that has a lot of bicarbonates, and this is a cell layer which produces the bicarbonates, and the blood supply, that even blood brings the bicarbonates and supplies to the epithelium for the protection. These are the three layers of protection that we have against the acid and pepsin and all that. So the gastric secretion, hydrochloric acid and pepsinogen, it follows a circadian rhythm. The acid secretion also produces circadian. It is very high, the highest in the midnight, from around 12 o'clock in the night to 3 a.m. The acid production is maximum, and early morning it is minimum. That is the circadian rhythm that the gastric acid production, physiological acid production, it is highest. The basal production, food related production, just like insulin production. Insulin, there is a basal production of the pancreas, and the bolus, the food related products, spikes, excursions. Same thing here, and there's a basal production of acid, which is more in the night and less in the morning. And again, one more wave of acid secretion, that is food related. Whenever we eat, the acid secretions is, so two different types of productions. One is basal, one is the food related spikes. That follows a typical circadian pattern. And this acid also helps in the protein. This acid helps in the protein fast digestion, and also it helps. The acid is important for the absorption of a lot of things like iron, calcium, magnesium, even B12. That's why whenever we are giving these tablets, like we have to give on empty stomach, like calcium, magnesium, iron, B12. So because for their absorption, acid is essential. So the antagonist of acid is your prostaglandin. Prostaglandins they play a very, very important role in defense mechanism. They protect the acid from damaging the epithelium. And it takes a very important role in maintaining the integrity and repair. Even there is a slightest damage because of the acid, naturally it gets repaired. Only when these mechanisms fail do we get the ulcers and all. So even the protection repair is a continuous damage, protection, repair, damage, protection, repair. This is a continuous process that goes on, that keeps the homeostasis of the gastric mucosa. And even this acid also kills the ingested bacteria. When we are eating, a lot of bacteria go into the stomach, and this acid helps to kill the maximum number of bacteria. Only which escape the attack of acid do go inside down and cause diarrhea and other infections in the intestine. But acid is very important not only for digestion but also for absorption of these nutrients, and also it kills the bacteria. So in coming to the ulcer peptic disease, this is the anatomy and physiology that we are talking about. The pathophysiology of the ulcer peptic disease, the ulcer, usually whenever there is a small damage, inflammation or small damage, we don't call them as ulcer. To qualify to call as an ulcer, the size of the defect should be at least more than 5 millimeters, more than 5 millimeters, and it should be, the depth should be up to the submucosa. It is only then that you have got a right to call it as an ulcer. Any superficial just discontinuity, this redness, you cannot call it as ulcer. So ulcer means it should be more than 5 mm, and the depth should be to the submucous area. So if the pathogenesis, the pathology, signs and symptoms, the mechanism, and the treatment is same for duodenal and gastric ulcers. Both are different, duodenal ulcer and gastric ulcer. The pathogenesis, the causes, and the complaint, the symptomatology, and the treatment, everything is same for duodenal and the gastric ulcer. But there are a lot of difference otherwise. What are the risk factors of this acid peptic disease? Who are more prone for these acid peptic disease, be it duodenal or gastric? Duodenal ulcers are more common in young people. Gastric ulcers are more common in elderly, people who are 50 and 60. So, who are the risk factors? Who are the people who may get these acid peptic diseases, ulcer peptic diseases? H. pylori infection. H. pylori previously, actually, gastric ulcer or duodenal ulcer were part of the textbook of surgery about 30 or 40 years back. Ulcers were always treated with surgeries. When we were student in Osmania Medical College, at any given time, now the incidence also has come down. When we were students, at any given point of time in general ward, we used to have at least 10 patients with ulcers, and most of them requiring surgical treatment like gastrointestinal, Billroth 1, Billroth 2, or pyloroplasty. So at any given time in the surgery list, we used to have at least 3 to 4 gastrointestinostomies. But since last 30 or 40 years, now because of the identification of the infection, infection as one of the causes of the ulcer diseases, that is H. pylori. Now, the topic of acid peptic disease has come to medicine now. If you see in medicine textbook, this acid peptic disease appearing. Previously, it was a surgery topic, actually, because of the treatment. Now, hardly we do surgery for acid peptic disease. Even for ulcers, we usually don't, unless there is a gastric outlet obstruction, the pyloric stenosis, all these complications. If there is a rupture, if there is a bleeding, if there is a perforation, it is only then that we go for surgical treatment. But otherwise, now most of the acid peptic diseases are being treated with just medical management.